Probably what I'm most excited about with respect to what's going on in the world of acne from a management standpoint would be the simplification of our strategies. What I mean by this is taking medications that we have used throughout the years, tried and true, and combining them, creating unique vehicles that allow us to deliver 2 or 3 medications in one, which ultimately makes adherence much more realistic. I realize we're in an era of the 14-step TikTok regimens, but we know how dangerous that can be, especially with someone who has a chronic inflammatory skin disease and established barrier dysfunction. So being able to simplify a routine, use maybe multiple agents in one time a day will increase adherence, but also decreases the likelihood for any potential secondary side effects and irritation, and of course, dysfunction of that stratum corneum that already is not feeling so great thanks to that acne. When I meet a new acne patient, there are certain things that I really look for, and my hamster on that wheel will start really running fast that will guide my treatment decision making. First and foremost, is there signs of scarring or dyschromia, both of which are harder to treat than acne? And if so, that will probably up my game in terms of the regimen and the complexity of that regimen from a systemic perspective will ultimately be. Now, in terms of how I talk to patients about it, that'll be pretty uniform because regardless of age, gender, skin tone, certain consistencies run throughout. First is, acne is not just a pimple. It is not something to be dismissed or undermined. It can be absolutely impactful. It could be life-altering, and we have to acknowledge the burden of disease, which will be different depending on it being a 13-year-old kid to a middle-aged career individual, because the impact of that visible disease will have different implications depending where you are in that life, and that certainly can add to the burden and the physicality of it. Next is, well, what do they want to do about it? I lay out the options, of which we have many, from topical to systemic, and I want to get a sense of how much they're willing to do, because I don't want to give them a complicated regimen only for them to get overwhelmed and confused and not use it. So I think getting understanding of where someone is in their tolerability of their disease, but also what they're willing to do and do over time, and that's the next thing, is really getting a sense of what they think the condition is and how you can effectively manage it. I've seen so many patients say, well, I tried this medication and it didn't work. What did you mean by that? Well, I used it for a week and it didn't go away. We know that topical agents take easily 8 to 12 weeks to have any impact. Same goes for systemic agents. So setting those expectations is only possible if you actually know their expectations. And sadly, many of these have been misguided by social media and information that is not vetted and nor evidence-based. So I think it's really getting an understanding not just of the skin condition, but also the person, understanding what they're willing to do, what they believe this to be, what they expect to happen over time to ensure proper management over time. This is a chronic condition. This is going to require something, maybe for years, maybe forever. It's different for everybody. But I think that's that first step in really having that conversation and understanding all those facets will ensure treatment success.